know what a rhinoplasty is? Well, if you don't, we are going to answer all of those questions today. Dr. Ward is here, facial plastic surgeon. So Dr. Ward, I don't even know if I know all the answers to this question. So let's talk about rhinoplasty versus non-surgical rhinoplasty.
Sure. So just in general, the term, the term rhinoplasty means, rhino means nose.
Yeah.
Plasty means fixing. So that's generically what it means. It's just fixing the nose.
Easy.
Rhinoplasty in general, when we say that term, we typically think about surgery, like we're going to take down the bump here, we're going to move the tip or whatever it might be. But in recent years, with the advent of filler, that we typically use for like cheeks or lips, people have been using it for the nose.
Really?
Which I have to say is not something that I think that people should take lightly, because it is, there are some risks associated with it. But it's really cool that you can change the shape of the nose, change some of the appearance of the nose with a quick little in-office procedure.
So tell me this, with filler, it's obviously filling in those gaps or those areas where you want more in your cheeks, or typically with a nose, I feel like sometimes people are trying to take away. So how does the filler work with that?
So this is one of the things that I think is the most interesting about being a facial plastic surgeon, is it's so much about light, shadows, where things sit. The same thing is true for our nose. So if you've got like a big bump on your nose, I've got kind of a bigger bump on my nose, or kind of a bigger tip that's droopy. Some of that appearance that that other people perceive, that I perceive, is how the light reflects off the skin. And so we can change that by adding a little bit of volume here or there. So for example, if you've got a big bump on the nose here, adding a little bit of filler here, adding a little bit here is going to help change how the light hits. In a case like mine, where I've got kind of a droopy tip, adding a little bit here can help lift up the tip. So it's going to kind of change the shape and how the light and shadows interact, which changes how we perceive it, how it shows up in photos, just how we view each other.
I had no idea that, usually I'm thinking people are using lip for filler, or filler for lips, or for your cheeks, things like that, but you can use it for your nose. So that's the non-surgical way. Now let's get into the surgical way.
Sure. So surgical way is doing things like you suggest, like taking down some of the bones. So again, if we were to use the bump on my nose as an example, maybe we want to take down some of the bump here, maybe some of the cartilage here on the tip of the nose we want to reshape or change. So in general, we think about a surgical way as a little bit more powerful in terms of the results that we can get, in terms of the permanency. The other interesting thing about surgical versus non-surgical is those of us who do facial plastic surgery and do a lot of noses, will tell you that non-surgical, even though it's simpler, it's easier to do, you can just do it in the clinic, you don't have to go to the operating room, most of us believe that it's actually riskier than a surgical procedure.
You're just so confident in what you do and knowing how to do it?
I think that's part of it, but I think part of it is the fact that when you're injecting something under the skin, one of the risks of fillers is that some of that filler can get into a blood vessel, and if it gets into a blood vessel, it can cause lack of blood flow to that area. So with filler in the nose, it's been associated with things where part of the nose dies, which is terrifying to think about.
Sounds really scary.
There's even been cases of blindness reported, where somehow, some way, some of that filler gets into the vessels of the eye and causes blindness. So we think it's risky to do non-surgical. So you need to see somebody who's familiar with the nose, who knows it inside and out.
I was just going to say, make sure you're contacting the right doctor. I also think that doing a procedure like that in general has got to be really scary for people. If they've hated their nose all their life, but to get to that point where they really want to do it, it still, I think, would be kind of freaky, right? So you really walk them through the procedure or the process. For
sure. And I think that one of the great things about being a facial plastic surgeon is that it's not so much about totally changing how somebody looks, but enhancing their natural beauty. So really trying to improve the way that their eyes look, improving their smile by getting the nose just a little bit smaller. It fits their facial proportions better, and it's really rewarding. It's really fun.
I do know some people who have done this, and they actually feel so much better about themselves. They look in the mirror and I think it makes them smile, and that's that's a big part of it, feeling confident in your own skin. So not changing who you are at all.
Totally.
Yep, absolutely. Well, Dr. Ward, thank you so much. As always, I learned a lot.
Thanks.
Ward MD has 3 locations: Cottonwood Heights, Riverton, and in City Creek. You can find more information at wardmd.com. Turning 26.